So today I'm in conversation with renowned physician and oncologist Professor Karol Sikora, who is a world leading authority on cancer. Thank you for joining me today to discuss the current waiting list times for cancer patients with the NHS. We know that there are over 230,000 urgent cancer referrals made by GPs in June alone, I believe, and it's estimated that there's somewhere in the region of 45,000 missing cancer patients going undiagnosed. I want to start by asking you what your views are on the current state of cancer care in the NHS and in particular your views on the waiting times.
So even before COVID, so way back in 2019, it seems ages ago, Tara, Britain was still behind European countries' survival rates for cancer. And the reason for that, almost certain, is the delays. This is before COVID, the delays in getting the diagnosis. COVID comes along and really hits the system hard. It hit Britain harder in terms of cancer than other countries because we don't have the capacity, the spare capacity to do the diagnostics. So Cancer Research UK, Britain's largest cancer charity, calculated there were 45,000 missing patients during 2020 if you take the whole year. We don't know now how many. I would estimate around 30,000 excess deaths from cancer caused by the switching off of normal health services in Britain because of COVID. And so time will tell how bad it is. And of course, the worrying thing now, you read about the waiting list for routine operations being somewhere in the region of 5.5 million people. Now, most of those operations are not going to be cancer. They're going to be for eye problems, cataracts, for hip replacements, for bad knees, bad backs, and so on. But a significant number will be patients who will be found when they get the operation to have cancer. And that's another source of delay. And delay is just bad news for people with cancer. They need to get on with treatment. The NHS has a target of 61 days from diagnosis to treatment, and that's very generous, and that's 2 months. Again, most European countries, you would wait 2 weeks before you got definitive treatment once the diagnosis is made. So the problem is we've been bad enough before COVID, and now, of course, it's a sort of catch up to try and move the whole thing forward as quickly as possible.
You mentioned as well in a recent article in the past week, actually, that at the Rutherford Cancer Centres, out of 2,000 patients treated, 700 have been in the past year, with many presenting later stage cancer, more than usually expected, as you say. That there's a time frame to everything, and where everything is being pushed back, I imagine you're seeing many more patients with later stage cancer than expected. And of course, they've not come forward for that treatment due to the pandemic and not wanting to burden the NHS. What are your recommendations with that in mind to the public who are still concerned about approaching their GP with health concerns, not wanting to take up resources?
I mean, everyone was so frightened and is still frightened by COVID. And of course, the propaganda from government, our government at the beginning, stay home, protect the NHS, save lives. The implication being to many that don't use the NHS, protect it. It's a valuable resource. Other people need it more than you. That's how people interpret it. So the first block is patients, the public. If they've got cancer-like symptoms, shortness of breath, cough, chest pain, lumps, anything like that, sore throat that persists, they need to go and see the GP. That's the point of entry into British medicine, British healthcare. And they have to persist. And GPs have become more elusive over the last year, I think, because they don't want to bring COVID into the surgeries. But you have to persist, and you can do it gently. There's no need to be aggressive, no need to be abusive to receptionists and so on. It is what it is, I guess. But persist to get an appointment, even a telephone appointment. It doesn't matter. I mean, it's unfamiliar to most people to have telephone consultations, but it's an effective way into the system as quickly as possible.
Do you think that if the government looked at their approach to COVID, their COVID response in the same way as they do to tackle the cancer crisis, should they do so with as much care and urgency as we've seen in the past 18 months? And would you call it a cancer crisis at the moment that we're experiencing?
I think it is a crisis. And I think what we've seen is a tremendous effort going to COVID, which we've never seen for other things like cancer, like general health of the population, serious morbid obesity, for example, mental health. All these things are clamoring for funding, and it all went into COVID. And, you know, one just wonders sometimes when you look around, and we're still all frightened by COVID, there's no doubt about it. But influenza kills as many people each year, and we don't go test and tracing for influenza. We don't all wear masks on the public transport because of the flu and so on. So it's a matter of getting things in proportion. COVID was frightening, there's no doubt, and it required dealing with. But we've also got other things to deal with, and we've got to get back to where we were and then to improve on them.
You've also said that, just kind of going back to the cancer crisis, and probably we can kind of finish here if you like, but you have said that when we look back in the next 5 years or in 5 years' time, the extent of the damage of the current cancer crisis, it'll only become clear then, really, with excess cancer deaths that will be in the tens of thousands, all preventable deaths, and a lot amongst younger people, as you mentioned earlier as well. How can the NHS and the private sector, where of course it isn't as much of an issue with kind of waiting times, but how can they keep on top of the waiting times moving forward kind of over the next couple of years?
So I think there are various agreements between the public and the private sector to try and get rid of backlogs, both for diagnostics and for treatment. And that's useful because that means things can move forward. And the private sector is doing it at the same price as the NHS is doing it. So what's called the tariff price. Moving forward, you're quite right. It's going to take a few years before we really know the seriousness of the damage, because cancer doesn't kill you immediately, it's slow. And so, you know, we know that people with early stage cancer, that's cancer confined to an organ like breast, lung, prostate, or colon, the four commonest cancers. Those cancers, if they're still within the organ they arose from, the chances of survival are nearly 90% with modern treatment. So that's fantastic. If it goes to stage 3 or 4, when it spreads a bit widely through lymph nodes, the blood, into other organs, then the survival drops to less than 20% for all 4 of these common cancers. So 90% to 20% is a big drop in terms of cure rate. So we'll only know really in about 5 years' time. Within 2 years, we'll have a good prediction, but the real data will be in 5 years' time. And we'll be looking at that to see what happened in 2019, probably very little because there wasn't much going on there. 2020 will be the disastrous year, and 2021, where we are now, will also, in the early part of this year, the first 6 months, will show an increased death rate from cancer. Now it's because of everybody pulling together, it's fairly balanced. I think we're getting back to where the figures are. So it's a year and a half of, we'll see a predominance of increased mortality, for increased deaths from cancer, and then it'll go back to normal. Now, that's assuming the pandemic's coming to an end, but I think everyone's agreed that it's not affecting the health services so much. There are only about 5,000 people in hospital that are COVID positive, and many of those, probably 60%, would be in hospital anyway. It's not because of COVID, they just happen to be positive for COVID, but they've had an accident, or they've got some other problem that they're in hospital for.
So in your opinion then, to kind of put people's minds at ease, what do you think the outlook is going to be then over the next few years? Is it going to be a huge burden, or as you say, is it just going to kind of level out if services aren't performing too poorly at the moment?
I think we're going to get out of the pandemic now and services will return to normal. I hope the politicians triggered to actually do something to improve the quality of healthcare, not just for infection, but for all the other things that we've been talking about, including cancer. And I think the one encouraging feature that I think is just great, the applications for people to go into the medical professions, doctors, nurses, physiotherapy, pharmacy, is much greater this year than it was in previous years. So people have been moved by it and they want to do something, and that's great. And getting more people into healthcare, because in a lot of parts of the country, not so much in the big cities where people like London, for example, or Birmingham, but in smaller places or at seaside resorts, it's very short supply to get labor, healthcare labor of all sorts, from doctors to hospital porters. So getting people into healthcare is a great endpoint for the pandemic. And obviously, governments have to plan to not let this happen again in the way that the whole service was so disrupted. And I think that lesson has been learned. We can't afford to do that again.
That's brilliant. I think if you can take one positive, it is, as you say, how many people have been influenced into wanting to get into healthcare and into care roles. I think that is wonderful. I think a lot of university admissions, isn't it, for healthcare roles have gone up massively. So it's that's really good to know. I suppose if I can take anything from it, and hopefully there's preventative measures to fix these kind of situations in the future.